Erectile dysfunction and low testosterone really go hand in hand. So as my guys get to their 60s, 70s, and 80s, testosterone will decrease. And I offer them, especially my guys that are still sexually active with their spouses, I'll offer them medicines. The medicines that everybody knows about are very expensive. Viagra, Levitra, Cialis, and not paid for by Medicare. So you'll have these guys paying 20 to 30 bucks a pill. And that's fine. What worries me is that since outside the U.S., using the internet at a much cheaper rate, because it's affordable. However, you have to really be careful, because if a medicine, even if it is packaged and looks like what you might get from an American pharmacy, it's not FDA regulated. And yes, there are some good things with the FDA, but if you're buying anything that's not FDA regulated, it can have adulterated other things in it. So you have to really be careful. And there's combinations of herbs that do work. Scutellaria, which is known as horny goatweed, maca. Those are both, even yohimbe, are commonly found in men's blogs about using those things as herbs. And when you put them into a capsule of some sort and buy them online, there's great touted effects when you use it on a regular basis. Nothing will work as good and as fast as the three prescriptions that I mentioned. But the reason I'm doing this video is not only to tell my guys to be careful about what you buy from outside the US, but the common thing, as I was getting to, is even if the testosterone levels are good, and I'm not talking about my 60, 70, or 80-year-olds, I'm talking about my 30-year-old guys. And yes, are having more and more guys at the age of 30 coming in for medicine or sexual dysfunction. And then usually what happens is I get testosterone levels, and testosterone levels are usually pretty decent, but the guys are still suffering. I'll get cortisol levels and find you're not sleeping well, or your cortisol levels are really low. And I'll put some links on the use of cortisol. But so even if the testosterone is low and we wind up giving testosterone pills or gel or injections, you have to be careful. My biggest suggestion is if there's a deficiency, you take care of it, like that low testosterone. You have to figure out why is it low. In a lot of cases, the testosterone will be low because the stress is high. When the stress that we go through, and I'm not talking about having a gun pointed at you, I'm talking about daily stressors, being late for work, being stuck in traffic, waking to an alarm clock and finding out that it's a Saturday, having somebody give you the wrong order in the drive-thru at McDonald's, having somebody not do their work or show up at work late and you have to do more work, a child is sick, anything. These are all small stressors, and they're considered invisible stressors because they're not the typical things you expect, but accumulated damage over the course of a day with all these tiny guys, these tiny stressors, will lead to the same stress response. So if the stress response is turned on all day long, minimal amounts, but there's no relaxation practice to turn off or neutralize the stress response, then you'll be in full flight or flight. When you're in fight or flight, you cannot be in relaxation and love. The body only exists in one or the other. There's no two at the same time. The fight or flight response is supposed to be mobilizing fat cells. It makes your blood pressure high, makes your heart rate fast, makes you have tunnel vision. It forgets making love and digesting properly and gets you ready for the fight. Versus the love reflex or the relaxation response, which helps with procreation, helps you find a mate, helps you problem solve, makes the brain grow, helps with digestion. Those are two different systems. So if you're in constant sympathetic response in fight or flight, then usually testosterone does not turn on. It's not a priority to have kids when you're in protect yourself mode. And that's the basic premise for if you're constantly stressed out, or again, if you have a lot of mini stressors, but you have no relaxation practice, well, guess what's going to turn on this? And if you try to turn that, if you just try to have sex, or try to have an erection and be with your partner, and you haven't answered the stress response, it's not going to work. It's said that the blood vessels to the penis are one of the smallest blood vessels in the body. I think it's about 1 millimeter, versus the coronary arteries, which go up to 3 to 5 millimeters. Really big. But that small blood vessel will stay constricted. When the blood vessel stays constricted and narrow, no blood gets, very minimal blood gets to that area. And in stress response, definitely the blood vessels stay tiny. And when you have tiny, even if you get stimulated, even if you're in love, even if you're doing great with your relationship and your event, if there's no blood flowing, then there's not going to be any tumescence, or there's not going to be any blood flow to the penis, and thus it'll remain flaccid. That's what those medicines do. Viagra, Cialis, Levitra. They're called Pde5 inhibitors, and they, I'm not going to go through all the biochemical stuff, but they make the blood vessel pop open. And when the blood vessels stay open, more blood flow, easier to maintain. But unfortunately, the side effects of that are that sometimes you'll open the blood vessels everywhere. You get a headache, you get a stuffy nose, I believe that you can get palpitations. You cannot use that with a nitrate. So just a little word of caution, some young people will be using yellow amyl nitrite. That's an inhalant that used to be popular in the 80s or so. And I think it's still coming back now. But that's also a form of nitro. Usually you'll think of nitro as something you put under the tongue if you have a heart attack problem. But when you use that kind of medicine, nitro, it will open the blood vessels, mostly to the coronary arteries, give you that flushed feeling. It saves lives. When you do that and you use those medicines together, Viagra, Levitra, Cialis, which open blood vessels as well, you'll have low blood pressure. So people who use both at the same time usually pass out because their blood pressure drops. So that's how the medicine works. But again, even if I give testosterone to guys, even if I give those 3 medicines to guys, if there is a high stress response, no relaxation response, those medicines will probably not work. So you have to be careful. I'll usually have guys come on in. I'll tell my guys, please try to work on, first I'll try to find the reason. I have to find the reason, as long as it's not medicine-induced, because prescription medicines can cause side effects. As long as it's not surgery-induced. Some of my guys that go for surgeries of the prostate cancer, enlarged prostate, unfortunately, the side effect of the surgery is you'll nick the nerve and you're not going to be able to have an erection. So that's unfortunate, but nowadays my surgeons are very good with nerve-sparing techniques. But as long as it's not those 2 things, then I usually will have my guys embrace a relaxation response. And not just for getting a better erection and having intercourse, but also for lowering the risk factors for heart attack. Exercise lowers heart attack, gets your testosterone elevated. It also relaxes you. Relaxation practice, hiking, nature therapy, meditation, yoga, tai chi, all these things work to bring up the relaxation response. And again, if you are really good with that practice, and I'm a yoga teacher, but some of my guys will usually have an apprehension about saying I'm not flexible, or I don't like yoga, or when I ask about exercise, they'll say they lift weights, and lifting weights is good, but again, you got to bring up the relaxation response. So if you have no practice of relaxation, then you're only going to be mostly a dominant fight or flight person. So that's why it is important, and it takes months. Just like using some herbs. There are herbs to help with the stressors of the day. I like ashwagandha, American or Asian ginseng. Both of them are really good. They work as adaptogens. They help the brain calm down. I mean, it has to be used for a prolonged amount of time. In addition to eating properly, if you eat properly, mostly whole food, plant-based diet, then that also works with relieving stress or relieving inflammation. Now, eating fruits and vegetables won't improve an erection, but it's a lifestyle. Again, if your lifestyle is improved, then usually the body will be in harmony. It won't be mostly stress, it'll be mostly relaxation response. And when you're in a relaxation response dominated day, you'll have good sex even, or an erection even at the age of 70 or 80. So my guys that go outside and buy testosterone thinking that you just jack up the testosterone and your erection will come back, no way. Number one, if you're using testosterone, it's not prescription. You got to be careful. Just like buying the look-alike Viagra, Cialis, and Levitra medicines from outside the country. If you go and mess around with testosterone outside the U.S. or not FDA approved or black market, you are asking for trouble. Even if you are good at injecting, you can't qualify the standardization or the quality of the tea that you're getting, and you could be injecting a lot of crap into your body and just jacking up the testosterone. Like I have some patients who do that. I advise them not to, but they're doing it for probably muscle gain or muscle mass. They still have problems with erectile dysfunction, and they're also full of acne and having problems with sleep and a little bit more aggressive personality. Those are all side effects. And most likely when you're on that kind of testosterone and using it for the wrong reasons, your own endogenous testosterone will turn off and your testicles decrease in size. So I really try to hold off on having my guys use testosterone, because once you start it, typically in prescription form it's a gel. Once you start it, the likelihood is your testicles will start to decrease their production and you'll be on testosterone for a long time. So if you're only using it for erectile dysfunction, work on the relaxation response. Again, using things like Scutellaria, also known as horny goatweed, yohimbe, maca, or the adaptogens, ginseng and ashwagandha are really good. You have to practice a whole food, plant-based diet, anti-inflammatory lifestyle, good sleep, relaxation practice, and usually do that for a couple weeks to a couple months and it'll work. If you're going to do the herb route and not do the other things, yeah, you might be successful, but herbs always take, usually they're 3 times a day, which is cumbersome if you ask me, and then they're expensive too, and they take a couple weeks to kick in. So there are some okay studies that say using individual herbs might help. Usually the blend of herbs help better. You will probably be able to get the erection going without all that stuff. It always really depends on your blood tests, your history intake that your doctor is going to be asking you. So please get a checkup. Don't just go buy this stuff online. And if we can't find anything, great. I would still say to lead a healthy life and include some form of good sex. You have to practice that anti-inflammatory living. And if it all else fails and you've done all that, then we get you to the urologist who have other ways to take care of looking for disease processes.